Imagine you are at home by yourself. Perhaps it is a quiet evening after a simple dinner. Or maybe it is a slow, peaceful Sunday morning before the rest of the world is awake. And then, something shifts inside your chest. It is not a dramatic pain. It is not the sudden, crushing blow you might expect. It just feels wrong. Now imagine that in that exact moment, you do not panic. You do not wonder what to do. You know exactly what this feeling means, and you know the precise steps to take. Because of that knowledge, when the paramedics arrive, you are still awake. You are still breathing. You are still here. That is not luck. That is preparation. My name is Dr. David. I have spent many years practicing as a heart specialist, a cardiologist. Over my career, I have seen patients survive major heart events that should have been fatal, simply because they knew what to do and they did it immediately. But I have also seen the opposite. I have lost patients, not because the ambulance was too slow, but because those critical first few minutes were lost to confusion and hesitation. Those first few minutes are what we are going to talk about today. But before we go any further, I must share a crucial truth with you. There is one single vital factor that decides whether everything I am about to teach you will actually work when your life is on the line. I will share that with you at the very end of this video. Please, do not skip ahead. Do not jump to the timestamps. Without this final piece of the puzzle, the rest of the information in this video is almost useless. Let us begin at the very beginning. Recognition. The biggest reason people lose those precious first minutes is that they simply do not realize what is happening to their body. We have all watched movies where a character suddenly grabs their chest, gasps, and falls to the floor. Yes, that can happen. But in the real world, that is not how most heart attacks begin. Usually the symptoms build slowly. They creep up over several minutes or even hours. Because the pain is not always severe right away, many people waste time convincing themselves that it is just indigestion, a pulled muscle, or fatigue. So, what does a real heart attack feel like? First, look for a heavy pressing, squeezing, or burning sensation right in the center of your chest. It does not have to be sharp. It might just feel like a heavy weight is sitting on you. Second, this discomfort often spreads. You might feel it travel down your left arm, up into your jaw, across your upper back, or even into your neck. Third, pay attention to sudden cold sweats that appear, even though you are not exercising or hot. Fourth, look out for unexpected shortness of breath, sudden dizziness, or a wave of unexplained nausea. But there is one more sign, and it is perhaps the most important. A deep, quiet feeling that something is fundamentally wrong with your body. Please do not ignore that feeling. A few years ago, I had a patient, a very active, healthy, 62-year-old woman. She came to see me 3 full days after her symptoms first started. She had experienced discomfort in her upper stomach and assumed it was just heartburn from a family dinner. Because she never felt the dramatic chest pain she had seen on television, she waited. By the time she arrived at my clinic, her heart had already suffered permanent damage. This brings me to a message I need you to hear, especially if you are a woman over the age of 50. Your symptoms may look completely different from the classic list. Decades of medical research show that women in this age group often experience heart events with absolutely no chest pain at all. Instead, they might feel a sudden, overwhelming exhaustion, not normal tiredness, but a feeling as if the floor has suddenly shifted beneath them. They might feel severe indigestion, sickness in their stomach, or a strange lightheadedness. Because these symptoms do not match the movie version of a heart attack, women wait on average 30 to 50 minutes longer than men to call for help. In medicine, we say time is muscle. A delay of 30 minutes is not just a wait. It is the difference between a complete recovery and permanent heart damage. The rule is very simple. If something feels wrong and you cannot explain it, call for help. Never wait for a dramatic moment that may never come. Now, let us discuss what to do while you wait for medical professionals to arrive. Before I explain the concrete techniques, I must be absolutely clear. These steps are only meant to buy you time. They are not a cure, and they are never a reason to delay calling emergency services. Your very first step must always be to call for an ambulance. What I am about to show you is only for the minutes between your phone call and the paramedics arriving. Let's look at how we address a sudden change in your heart rhythm. During a heart event, the heart can lose its steady, natural rhythm. When this happens, less blood reaches your brain. Within seconds, you can start to feel faint, and within a minute, you could lose consciousness entirely. When you take a deep breath and cough forcefully, you create a sudden pressure inside your chest. This pressure acts like a temporary manual pump. It physically pushes blood up to your brain and keeps you awake. In some cases, this sudden change in pressure can even help nudge an irregular heartbeat back into a safer rhythm. But this only works if you do it correctly. Here is exactly how to perform the controlled cough. Take a very deep breath, filling your lungs completely. Then, cough hard. It must not be a gentle, quiet cough. It must be deep and forceful, starting from the bottom of your chest. Repeat this cycle every 2 seconds. Inhale deeply. Cough hard. Inhale deeply. Cough hard. Keep doing this for as long as you are conscious. This simple, controlled action can keep vital blood flowing to your brain when your heart is struggling. It requires no special equipment, and you can do it completely on your own. Let me ask you a quick question here. Do you happen to know your normal resting heart rate? Just the number. If you do, please write it in the comments section below. I have a very specific medical reason for asking, and I will explain exactly what it means for your health in my next video. The next approach is a tool of last resort, known as a precordial thump, and it comes with very important safety warnings. The idea behind this action is that a single sharp blow to the center of your breastbone can create a tiny electrical charge in the heart muscle. In the very first minute of a severe rhythm issue, this small charge can sometimes act like a tiny manual defibrillator to reset the heart. To perform this, make a fist. Use the soft, fleshy side of your hand, the part right above your wrist, not your hard knuckles. Deliver a firm, controlled strike directly to the middle of your breastbone. Just 1 or 2 firm, deliberate taps. Now please listen to this warning very carefully. If you have osteoporosis, weak bones, or if you take blood-thinning medications, do not use this technique. The risk of breaking a bone or causing internal bleeding is too high. If those conditions apply to you, skip this step completely and focus entirely on your deep breathing and controlled coughing. Part of being prepared is knowing which tools are safe for your specific body. Finally, we can look at the sensory nervous system by using what is known as the Hegu point. This step comes from traditional practice, but it has a very real biological effect that we cardiologists highly value. The Hegu point is located in the soft, fleshy web of skin between your thumb and your index finger. When you press this point firmly, you stimulate a part of your nervous system called the parasympathetic system. This is your body's natural brakes, the system that calms you down and fights against panic. During a medical emergency, panic is highly dangerous. It floods your body with adrenaline, making your blood pressure spike and your heart beat even faster. This puts a massive, extra strain on an already struggling heart. To use this point, take the thumb of your opposite hand and press firmly into that soft web. Move your thumb in slow, steady circles. As you press, control your breathing. Breathe in slowly through your nose for a count of 4. Then, blow the air out slowly through your mouth for a count of 6. By making your exhale longer than your inhale, you physically force your heart rate to slow down. Switch hands every 30 seconds. This will not stop a heart attack on its own, but it will keep your mind clear, prevent dangerous panic spirals, and help the other physical techniques work much better. Knowing these techniques is helpful, but you must know the exact order to use them. Let us go through the step-by-step sequence together. First, call for help immediately. This is always your first action. Do not wait to see if the pain goes away. Call your local emergency services. Put your phone on speakerphone and place it on the ground beside you so your hands remain free. State your address clearly. Tell them you believe you are having a heart attack and leave the phone line open. Second, get down on the floor. Do not try to walk around. Do not try to tidy up or walk to the front door. Sit or lie down gently on the floor. If you do happen to pass out, being close to the ground prevents you from falling and suffering a serious head injury. Third, chew an aspirin if it is safe to do so. If you have plain aspirin at home, chew 1 tablet slowly instead of swallowing it. Chewing helps it enter your bloodstream much faster. Aspirin helps thin your blood and can slow down the clot forming in your heart. Just remember, only do this if you are not allergic to aspirin, do not have a stomach ulcer, and are not already taking other prescription blood thinners. If you are unsure, skip this step. Fourth, begin your emergency techniques. Now is the time to start the controlled coughing pattern. In between coughs, apply firm pressure to your Hegu point and practice your slow 4-second inhale and 6-second exhale. Keep to this exact order. Phone call first, get to the floor, take aspirin if safe, and then perform your breathing and pressure techniques. While knowing what to do in an emergency is life-saving, the ultimate goal is to make sure you never have to use the sequence at all. Let us talk about a few simple daily habits that protect your heart. Think about your evening routine first. 2 hours before you go to bed, turn off all screens, your phone, television, and tablet. The blue light from these screens stops your brain from producing melatonin. While most people think melatonin is just for sleep, it is actually a powerful shield for your blood vessels. Over many years, losing this nightly protection increases your risk of heart problems. Also, avoid eating heavy meals close to bedtime. Digestion requires a lot of blood flow. forcing your heart to work hard at the exact time it should be, resting and recovering. Try to dim your lights an hour before bed, eat light evening meals, and keep a consistent sleep schedule. Next, adjust your morning routine. Tonight, place a glass of water on your nightstand. Tomorrow morning, before you stand up or check your phone, drink it. While you sleep, you lose water through breathing and sweating. By morning, your blood is naturally thicker and more likely to form clots. This is why most heart attacks happen in the early hours of the morning. Drinking a glass of water first thing in the morning helps thin your blood and protects your heart. It takes 10 seconds, costs nothing, and is incredibly effective. Finally, we should look at your general nutrition. You do not need a perfect diet. You just need to move in the right direction. Try to add fatty fish, like salmon or sardines, to your meals twice a week to lower inflammation. Enjoy fresh berries for your blood vessels, oatmeal to help manage cholesterol, and a little olive oil to protect your arteries. At the same time, try to reduce processed meats like sausages, bacon, and packaged deli slices. These are loaded with sodium and preservatives that damage your blood vessels over time. Now let us return to the promise I made at the beginning of this video. Why did I say that for many people, these techniques might not work when they are needed most? It is because of panic. When you are alone, scared, and in pain, the thinking part of your brain shuts down. You cannot easily remember steps you only watched once in a video. In a crisis, your body does not rely on memory. It relies on practice. If you do not practice these steps now, while you are healthy and calm, you will not remember how to do them when it matters. So, I have a very small request for you. Do not wait. Tonight, sit in a quiet chair. Set a timer on your phone for just 60 seconds. Practice the deep, forceful cough. Find the hegu point on your hand and practice the slow, calming breathing pattern. Teach your body how it feels to be calm. Then, share this information with a loved one, a neighbor, or a friend. When people around you know the warning signs, your chances of a healthy, safe recovery increase dramatically. Have you ever experienced a strange chest pressure or a sudden shortness of breath that you just brushed off as stress or indigestion? Please share your story in the comments below. I read them all, and your experience might help someone else realize they need to take their symptoms seriously. In my next video, I will share the subtle warning signs that can appear weeks before a heart attack actually happens. To make sure you do not miss that life-saving information, please subscribe to the channel and turn on notifications. If you found this video helpful, giving it a thumbs up helps ensure other people can find this information when they need it. Thank you for spending this time with me today. I'm Dr. David. Stay safe, stay prepared, and take care of your heart.